How do cardiac valves affect stroke risk? Imagine your heart as a busy traffic intersection, with valves acting like traffic controllers that keep blood flowing smoothly in one direction. When these valves work properly, blood moves efficiently through the heart and to the rest of the body. But if they malfunction, it can cause traffic jams or even accidents that might lead to a stroke. So, understanding how these valves influence stroke risk is really important, especially when doctors use tools like echocardiograms to look inside the heart. There are four main valves in the heart: the mitral, tricuspid, pulmonary, and aortic valves. Each one has a specific role in directing blood flow. When these valves develop problems, they can sometimes lead to conditions that increase the chance of a stroke. For example, the aortic valve, which controls blood flow from the heart to the body, can become narrowed in a condition called aortic valve stenosis. This narrowing causes high shear stress, which can damage the blood and make it more likely to form clots. These clots can then travel to the brain and cause an ischemic stroke. If this condition is severe, replacing the valve through surgery or less invasive procedures like transcatheter aortic valve replacement can help reduce the risk, but each approach has its own considerations. Another common valve issue is bicuspid aortic valve, a congenital condition where the valve has only two cusps instead of three. People with bicuspid valves often have a higher risk of stroke, partly because this condition is linked to atrial fibrillation, an irregular heartbeat that can cause blood clots to form in the heart. These clots can then break free and block blood flow to the brain, leading to a stroke. Then there is mitral valve prolapse, where the mitral valve leaflets bulge into the left atrium during heart contractions. While this condition was once thought to be a major risk factor for stroke, recent studies suggest that the risk is more influenced by other factors like high blood pressure and obesity. Still, in some cases, mitral valve issues can contribute to stroke risk, especially if they lead to irregular heart rhythms or blood clots. When doctors suspect a stroke, they often perform an echocardiogram, which is an ultrasound of the heart. This test helps visualize the heart's valves and chambers, revealing any abnormalities that might be causing blood clots or irregular heart rhythms. Detecting issues like atrial fibrillation or valve leaks early can be crucial for preventing future strokes. Managing stroke risk related to heart valves usually involves treating the underlying problem. Medications like blood thinners may be prescribed to prevent clot formation, especially if atrial fibrillation is present. In some cases, surgical procedures to repair or replace faulty valves are necessary. For example, a valve replacement might be recommended if the valve narrowing is severe enough to pose a significant risk. It's important to remember that each patient's situation is unique, and treatment plans should always be tailored to individual needs. In summary, cardiac valves play a vital role in preventing stroke by ensuring proper blood flow. When these valves develop problems, they can increase the risk of blood clots or irregular heart rhythms that may lead to a stroke. Using diagnostic tools like echocardiograms helps identify these issues early, allowing for appropriate treatment to reduce the risk. Always consult with healthcare professionals for personalized advice and management options to keep your heart healthy and your brain safe.